All right, hey, I'm Dr. Hagmeyer, and in my last couple of videos, I've talked about the symptoms of high TSH. I talked about the causes of high TSH, and so today I want to talk to you about some of the different treatment options you should be aware of if you in fact have a high TSH. When it comes to a high TSH, you may be wondering if taking thyroid medication is the only treatment option available to you. You may also be wondering, when it comes to taking thyroid medication, do you have to take it forever, right? And what are the side effects of taking thyroid medication that you need to be aware of? I receive a lot of emails regarding my last video asking me if I could review the different treatment options that are available to people when they do find out that they have a high TSH. So in today's video, this is exactly what I'm going to be reviewing with you today. I want to review the different treatment options, but also some of the pros and the cons of each one. I'll also share with you the reasons why I think most patients never get better. So let's get started here. Keep in mind that when it comes to thyroid disease and supporting the thyroid gland, you can't fix what you don't know. You see, I see a lot of doctors and patients trying to fix these thyroid symptoms, but yet they have no idea what the root cause of those symptoms are in the first place. And so again, they never get better. How can you fix something if you don't know what caused it? What I find is that most patients with thyroid disease, they never get truly well because of the following reasons. Number one, limited testing. Doctors are just not ordering the correct testing. Number two, the kinds of testing that's being done, or being run I should say, are inadequate. And number three, reference ranges that are being used to determine if a problem exists and to what extent are almost 100% inadequate. And I would bet that if you're watching today's video and you're still suffering with many of these unresolved thyroid symptoms, I would bet that you fall into one of these three categories that I just mentioned. So the very first thing that needs to happen is if you're starting out on this potential roller coaster ride as it relates to thyroid disease, is you want to start out with a complete thyroid panel. Not just a TSH, not a TSH with a reflex, and not a TSH with just free T4, but rather a complete thyroid panel. Now, if your doctor will not order you a complete thyroid panel, and very few will, unfortunately, I want you to know that you can visit my website and you can order a complete thyroid panel, and it includes a consultation. All right, so you can go back. I'll leave the link here in the description box, and you can read more about why having a complete thyroid panel is so critical to properly managing thyroid disease. Okay, so let's get into this. Let's jump right in. What are your treatment options for a person who has a high TSH or a high normal TSH? Let's say, for the purpose of this video, that you have a TSH level of 6.0. The standard reference range for most labs fall between 0.5 all the way up to 5.0. So what do? What are your options? Well, option number one is thyroid hormone replacement. This is the standard protocol. This is basically what every medical doctor does when a patient has an elevated TSH. And this is probably what your doctor is going to recommend to you if your TSH levels are elevated. Now, the problem with this is, while this may work in lowering your TSH levels, it doesn't address the root cause of the elevated TSH. We still haven't figured out the cause of the high TSH. And if all you do is take thyroid hormone replacement, all you've done essentially is topped off the low hormone levels. You haven't identified the root cause of why that TSH is elevated, and it will not fix the problem. But for some people, and for a very short period of time, it can reduce some of your symptoms. The downside to this, of course, is that thyroid replacement does have side effects. Osteoporosis is a huge concern, especially if you're a menopausal woman, or if you're a woman in her 30s or 40s, right? Most women go on to find out that they have osteoporosis in the 50s and 60s. So again, you could be setting up the stage or accelerating that bone loss by taking thyroid replacement. So that's a big one. Also, many patients will experience things like sweating attacks. They'll experience anxiety, inward tremors. If they have irritable bowel syndrome, those symptoms will get worse. They may have increased heart palpitations or increased heart rate. They may experience increased insomnia or tremors or further irritability. And we now know from several studies that have been published over the last 2 years or so that thyroid replacement causes something known as SIBO, S-I-B-O, or bacterial overgrowth. And so if you have irritable bowel syndrome, this is something that you need to understand more, the relationship between SIBO and bacterial overgrowth. Or I'm sorry, between SIBO and IBS. Now the other thing is I get lots of emails from many of you telling me your experiences with thyroid replacement and how much worse you are. So the other downside to the hormone replacement model or the replacement approach is that at some point you will most likely be over-medicated, right? And there's an entire video that I did on my YouTube channel that reviews the symptoms of being over-medicated and what you need to watch out for. So again, I highly encourage you to watch that video and keep those symptoms in the forefront of your mind and recognize those, right? So if you do decide to take this replacement model approach, you should have your levels tested every few months, and be aware that those who do take thyroid replacement, again, you are at high risk for being over-medicated at any given point in time, all right? And again, that's why retesting more frequently should take place. The second treatment option for a high TSH includes the use of natural or desiccated thyroid hormone replacement, or a combination of what we call T4 and T3. Right? So again, this is where you might hear about medications like Cytomel, which is given when T3 levels are low, or Thyroid or Armour, which are both combination preparations of both T4 and T3. So both Thyroid, Armour, and WP Thyroid, all three of those contain a combination of T4 and T3. Now, again, with this treatment option, there's a good chance that the testing ordered by your doctor will include looking at those T3 levels. They may look at things like reverse T3 and free T3, and maybe even a total T3. But again, the biggest problem with this approach is that this is still not addressing the root cause of why that T3 is low in the first place, or why that reverse T3 might be elevated, or what to do in a scenario where you've been tested for thyroid antibodies and now your thyroid antibody levels are elevated, right? So again, this kind of approach, while it's slightly better than simply just prescribing a T4 preparation, it still is just topping off thyroid hormone levels. In this case, it's just topping off low T3 levels. The treatment premise, again, is the same. It's a replacement model rather than a root cause and supportive model of treatment. Now, there are many reasons why your T3 levels are low, or why you may have one of these 6 patterns that I talk about in my free thyroid guide. But simply taking a T3, T4 combination, Armour or Thyroid, still does not address the real problem. It still, again, only treats the low T4 or low T3, while the underlying root cause of the disease continues. And so that brings us to treatment option number 3. Now, the third treatment option for a high TSH requires you to work with a doctor who looks at the big picture, right? Your best bet is to find a doctor who is certified in functional medicine. And if you've never heard of functional medicine before, you can watch this video that you see here. This video explains what functional medicine is, why it's so successful, and why functional medicine is truly a healthcare model as opposed to a disease management model. Now, when it comes to functional medicine, you'll want to make sure that your doctor, again, is certified in functional medicine. Many doctors are jumping on the functional medicine bandwagon, claiming to practice functional medicine, but yet they still prescribe medication rather than looking at the root cause. When it comes to functional medicine or a root cause-based approach, your doctor is going to order a complete thyroid panel to look at the pattern of thyroid disease that's showing up. But now, once that pattern has been identified, we need to now know what's causing that pattern. Why are you in that pattern? Blood work alone is not enough to uncover this. Most likely, in this based approach, in this functional based approach, the root cause medicine, your doctor is going to run a variety of other tests that will include things like saliva testing and urine testing, maybe breath testing, to better understand why you have this particular pattern, right? So let me explain this a little bit more. There are 5 major patterns of thyroid disease, okay? Well, there's actually 6 major patterns if we include autoimmune thyroid disease, which is that Hashimoto's. And so, again, out of these 5 patterns, a complete thyroid panel is needed to identify what pattern you have. So again, what's important to understand here is that you first identify what pattern of thyroid disease you have, right? A free T4 test is just not enough information when that's combined with TSH, unless the doctor that you're working with, his whole approach is just going to be prescribing thyroid replacement. You see, if all you have done is a TSH and a free T4, there are way too many pieces of this puzzle that are missing, so to speak. So again, keep in mind that if your doctor is only running a TSH and a free T4 test, he or she is not looking at what pattern you have, because again, you can't substantiate, you can't identify what pattern you have with simply those markers. Again, to me, when I see those kinds of tests being run, when I review a new case, I know right away that the doctor that they had just been to was not looking at the big picture or practicing root cause medicine. Again, you can't fix what you don't know. So remember this, TSH and free T4 is only useful if you plan to treat the thyroid disease with the topping off method of thyroid replacement. One thing you should be aware of when it comes to thyroid testing, and you may want to write this down, is that when testing for autoimmune thyroid disease, it's important that you get both thyroid antibody levels tested. And the reason I say both thyroid antibody levels tested, and there's two, predominantly if we're suspecting low thyroid or hypothyroidism, is because many times I will review a patient's blood work and I see testing that comes back and only one of the thyroid antibody levels were tested. So again, make sure that both are tested. All right. The other thing is, if you have not found success with your treatment plan so far, most likely your doctor has not uncovered what your root cause includes. Each and every one of us has a different root cause, and with functional medicine, our approach to treatment is based on understanding what the root cause is in that particular individual. Now, one thing I want to mention is that once the pattern is identified, functional testing should be implemented to determine the best course of treatment possible. So what that means is that further testing to understand and to investigate those causes might include things like looking at the gut microbiome, looking at cortisol levels, looking at your infectious load, looking at liver function, looking at nutritional deficiencies, methylation pathways, genetic SNPs, food sensitivities, oxidative stress, hormonal imbalances. Again, this is where the expertise of your functional medicine doctor will come in. They will be able to determine the most appropriate testing for your specific needs. If you download my free thyroid guide, which can be found on my website under the thyroid section, I explain more about these different patterns and some of the causes behind each of these. So I encourage you to download this free guide and become educated on this, because quite frankly, no one is going to care more about your health than you. So again, just as a quick summary as we wrap up today's video on treatment options for high TSH. Number one, there are really three ways to approach thyroid disease and high TSH levels. We can treat thyroid disease with synthetic thyroid medications like Synthroid and levothyroxine. You can treat thyroid disease with T4, T3 preparations like Armour, Cytomel, NatureThyroid, WP Thyroid, or you can treat thyroid disease from a root cause perspective using the premise of functional medicine. If you treat thyroid disease with synthetic thyroid hormone replacement or a T4 or T3 replacement, you're only addressing the symptoms. And keep in mind, whether you take synthetic thyroid replacement or natural thyroid replacement, you're still only topping off the thyroid levels that are low. You still haven't addressed why the TSH is high and why the thyroid levels are low. If you decide to work with a certified functional medicine doctor who looks at the big picture, this approach will give you the best chance at not only feeling your best, but also addressing the root cause of your problem. So there you go. I hope you enjoyed today's video. If you have questions about working with me or with one of my nutritionists in my practice, again, whether you need help with implementing a particular diet or you're looking to dig deeper into the root cause of your health problems, visit my website. Take a look at the Start Here button that you'll find in the upper left-hand corner. Tell me a little bit about the kind of help that you're looking for, what your goals are, what you're struggling with, and most importantly, how I can be most of help to you. We'll send you out an email within just a few minutes and some recommendations and links if you'd like to further discuss your case with me. So I hope you enjoyed today's video. Till next time, I'm Dr. Hagmeyer. Take care.